CCHT practice test exam questions. What would be the accurate definition of an atom? The smallest particle of an element that retains the property of the element. What type of system involves a two-step procedure where the dialysis fluid is first prepared and then stored in a reservoir before being circulated? Batch delivery system. Among the following options, which one would not be regarded as a primary laboratory examination for assessing the effectiveness of a hemodialysis treatment? Hemoglobin. Which of the following factors would not increase a patient's likelihood of developing chronic kidney disease, CKD? Genetic predisposition. What element wouldn't be considered necessary for record keeping if a dialysis center implements a dialyzer reprocessing protocol? Reprocessing expense. For a patient with kidney issues like our patient, Anthony, which, among the list of organization is not recognized as a patient organization? National Renal Administrators Association, NRAA. Which substance is typically eliminated by the carbon tanks in the salt concentrate? Chlorine. Which other polymer, along with polyethersulfone, is recognized as a material suitable for constructing synthetic dialysis membranes? Polycarbonate. Which organization offers monetary assistance to individuals like Henry, struggling with kidney ailments? American Kidney Fund, AKF. Suppose a patient, let's call him James, is suffering from chronic kidney disease and is experiencing bleeding complications. Among the following options, which one is not typically a responsibility of the technician/LPN in managing James' bleeding issues? If bleeding occurs, increase the heparin dosage. Among the provided options, which one accurately describes the process of diffusion? The process where the solutions interact via a semi-permeable membrane. What proportion of additional protein does a dialysis patient, compared to a healthy individual, need in their diet? 50. What medical procedure is regarded as a gold standard for diagnosing acute interstitial nephritis? Renal biopsy. When planning educational sessions for a patient undergoing hemodialysis, various patient factors are taken into account. However, which of the following factors is typically not considered? Financial status of the patient. What would be incorporated into the fundamental curriculum modules for the education of the dialysis technicians/nurses, along with learning objectives? Glossary. What would happen if a clinical hemodialysis technician such as Nurse Jane reduces the pressure and flow in the reserve osmosis RO pump? The flow of product water will be reduced. Among the which actions which one would be deemed suitable for a technician to perform while concluding a patient's hemodialysis treatment? Check the patient's lung sounds. Out of the following options, which one is not considered a part of the precautions taken during dialysis? Registering and invoicing for the dialysis procedure. Once the dialysis needles have been inserted by the technician or LPN, what is the most frequently employed technique to ensure the needles stay in place? Butterfly technique. In the context of hemodialysis, the heparin pump and which other component is regarded as elements of the extracorporeal circuits? Blood flow monitors. In the context of hemodialysis, which site access is most likely to lead to an infection, such as in the case of a patient named John? Central venous catheter. What type of medication is typically used to manage conditions like edema and hypertension, which can either be a cause or a result of renal insufficiency. Diuretics. What could be seen as a benefit of utilizing the overnight in-center hemodialysis program? Reduced dietary limitations. What is the primary risk associated with a kidney transplant procedure? Rejection. In the central delivery system used for dialysis, what is the ratio of treated water to concentrate that is mixed to create the dialysate? 34:1. What is the primary reason for conducting the COPS, Consumer Assessment of Healthcare Providers and Systems, program surveys among patients undergoing dialysis? To determine the effectiveness of the hospital's marketing strategy. Considering all the possible strategies to regulate the electrolyte levels in a dialysis patient, which one among them wouldn't be beneficial? The patient should drink as much fluids as possible. Question: what potential medical issues should the technician or LPN be aware of that might affect a chronic kidney patient, Mr. Smith? Peripheral vascular disease, atherosclerosis. What action should not be taken by a technician or LPN while cannulating a patient? Rotating the needle 180 degrees post-insertion into the access. What would be the appropriate way to describe the transmembrane pressure, TMP, in the context of hemodialysis? The average pressure discrepancy over the membrane.